one thing I always do is I always send people for second opinions. You must see this other person or some other people so that you are getting a different opinion. But one thing I talk to them about is sexual function. And I find often that when they come back, they're like, no, the doctor says I'll be fine if and I'm like, okay, but I'm letting you know, you need to know how your body responds to pleasure and how are you going to feel if that's interrupted. And, we often sell it like, oh, but you're not going to have pap smears for the rest of your life. You don't have to worry about that. Nothing's ever going to fall. Or, yeah, but if you don't have an orgasm again, it's a big deal. It's a big deal. And I always get into it with the laparoscopic surgeons all the time. There's a lot of dissection that goes there, and pelvic anatomy and all of those nerves don't just go to one place. So I think we have to acknowledge it and have an uncomfortable conversation about, okay, so how do you orgasm?
Absolutely. It's so interesting because
Yeah.
the studies on it really came from people with spinal cord injuries, right? Because the cervical orgasm pathway isn't the same as, a typical orgasm pathway. And so it bypasses the spinal itself and goes straight to the brain. So I think that through the vagus nerve. And it's so interesting because that's how we learned that these patients that had spinal cord injuries could still orgasm because their cervix was still present.